Good morning, Rob Taylor. I am Mihiraa. Let's start the warm-up sessions. Tell me about yourself.
I'm a dedicated and compassionate individual with a passion for medicine. I pursued a rigorous education in medicine and have gained valuable experience through internships and clinical rotations. I'm committed to providing high-quality patient care and continually strive to expand my medical knowledge and skills.
What are your strengths and weaknesses?
One of my strengths is my ability to communicate effectively with patients and colleagues, which fosters trust and collaboration in a healthcare setting. As for weaknesses, I tend to be overly critical of my own work at times, but I've learned to channel this into self-improvement and seek feedback from peers and mentors.
How do you handle stressful situations?
I thrive in high-pressure environments and remain calm and focused during stressful situations. I prioritize tasks, delegate when necessary, and rely on my training and experience to make informed decisions under pressure. I also make time for self-care activities like exercise and mindfulness to maintain my well-being.
Can you provide an example of a challenging patient interaction and how you handled it?
In one instance, I encountered a patient who was hesitant to follow the recommended treatment plan due to cultural beliefs. I took the time to listen to their concerns, address misconceptions, and involve their family members in the discussion. By building trust and rapport, I was able to collaborate with the patient to develop a modified treatment approach that respected their beliefs while prioritizing their health.
Describe a situation where you had to work as part of a team.
As a healthcare professional, teamwork is essential for providing comprehensive patient care. In one scenario, I collaborated with a multidisciplinary team to develop a treatment plan for a complex medical case. Each team member brought unique expertise to the table, and through effective communication and coordination, we were able to deliver optimal care and achieve positive outcomes for the patient.
You can now start the role play.
Good morning, Mihiraa. It's good to see you for your routine health check. However, I've noticed there have been some changes since your last visit. Your BMI results are in, and I've noticed there's been a significant increase since your last visit. I understand this might be concerning for you. How have you been feeling lately?
Very good morning, doctor. Well, yeah, I've noticed that too. It's been a bit of a struggle, Been working long hours at the computer, and it's just so tempting to snack on cakes and biscuits throughout the day.
I see. Can you tell me more about your diet and lifestyle? How often do you find yourself indulging in takeaway food and snacks?
Well, doctor, my diet hasn't been the healthiest lately, I must admit. I find myself indulging in takeaway food and snacks quite frequently, especially during my long hours of work. It's just so convenient to grab something quick when I'm busy at the computer. I wouldn't say I have any psychological issues related to my eating habits. It's more about convenience and comfort,
Understandable, Mihiraa. However, it's crucial to address these habits, particularly considering your family history of heart disease. I can only imagine how difficult your father's passing must have been. That's why it's so important for us to take proactive steps now to prioritize your health and well-being.
Doctor, I appreciate your concern. Yeah, it was a shock, but I don't think it'll happen to me. I can't control my weight, It's just how it is. My weight feels like it's beyond my control. I've tried to make changes in the past, but nothing seems to stick. It's frustrating, to be honest.
I understand how challenging it can feel, Mihiraa. However, even small changes can make a big difference. Let's explore some lifestyle adjustments together that could help facilitate weight loss. We can consider modifications to your diet and perhaps find ways to incorporate more movement into your day, even with your sedentary work routine and knee arthritis. I'm here to support you every step of the way.
Doctor, I hear what you're saying, but exercising is incredibly difficult for me. With my demanding work schedule and the arthritis in my knee, finding the time and energy for physical activity feels nearly impossible. I wish it were as simple as just making a few changes, but it's not that easy for me.
Mihiraa, I want to emphasize the importance of understanding the risks associated with obesity. While I recognize the challenges you face, it's crucial to consider the potential consequences for your health. Obesity increases the risk of serious conditions like cardiovascular disease and type 2 diabetes, both of which can significantly impact your quality of life. I'm here to help you navigate these risks and find manageable ways to improve your health. Let's work together to address this in a way that feels achievable for you.
Doctor, I understand the concerns you're raising, but I'm confident that what happened to my father won't happen to me. I know my family history, but I truly believe I'm different. I don't think I'm at risk of heart disease or diabetes.
Mihiraa, I understand your perspective, but I still think it would be beneficial for us to explore some additional support options. Given the complexities of managing weight and the impact it can have on your overall well-being, I'd like to suggest a referral to a dietitian. They can offer personalized guidance on nutrition, consider alternatives to high-calorie snacks, and help you develop a plan that suits your lifestyle and preferences. Additionally, considering the challenges you've mentioned with your diet and the potential emotional factors at play, I also recommend speaking with a psychologist. They can provide valuable support and strategies for addressing any underlying issues that may be contributing to your current situation. It's important to have a comprehensive approach to your health, and these professionals can work alongside us to ensure you receive the best possible care. What do you think, Mihiraa?
I'm still a bit hesitant about seeing a specialist, doctor. But I suppose I could give the dietitian a chance. If it might help, then it's worth a shot. Let's go ahead and schedule that appointment.
That's a positive step, Mihiraa. I'm glad you're willing to give it a try. I truly believe that working with a dietitian can provide valuable insights and support to help you on your journey toward better health. I'll arrange the appointment for you, and we can continue to monitor your progress together. Remember, I'm here to support you every step of the way.
Thank you, doctor.